Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today, this is the continuation of the series of Ayurvedic Shlokas, important Shlokas, recitation and discussion. Let us start. This is part 3. So I request all of you, this may be 10, 20, 30, but you will get a lot of knowledge about Ayurveda when you hear all these videos, okay? Causes of Pitta Prakop. As I have told you, Vata, Pitta, Kapha are the bioenergies. Vata is responsible for all types of movements. Pitta is responsible for all types of digestion, transformation, metabolic processes, and Kapha is for nutrition, stability, and growth. So let us talk about Pitta Prakopa. Krodha, tremendous anger, hot-tempered personality. They will get the Pitta Prakop and acidity and bleeding piles and this and that ulcers. Okay. Shok, excessive anxiety, bhaya, fear, phobia, ayas, upavas, too much fasting. The Pitta Prakopit people should take regularly every after 3-4 hours a little food. That is very important for the Pitta people. Pitta Pradhan, dominant Prakriti. Vidagdh, Maithun, unsatisfactory type of the intercourse or the coitus or the sexual relationship. If there are mal mismanagement in the this type of the sexual relationship, then that also causes the Pitta Prakop. Upagamana, Katu Amla Lavan. In the food, if you take a too much spicy, Katu, Amla sour, Lavan salty, Tikshna, alcohol, smoking, then Tikshnata, whatever the too much tea and coffee, all these drugs, especially the narcotics, this is Tikshna. Laghu, that means your activities, your too much activities, fast food, fast lifestyle, that is a fast degeneration of the cells. Laghu, lightness, which activity will increase the lightness. Too much exercise is also not good for the Pitta Prakop, Pitta people. Vidahi, very irritating food. Tila, excessive oil, fried food. Taila, pinyak, kulat, horse gram. Sarshapa, this is Mohri in Marathi. So this is Sarshapa, Atasi, Harita Shak, Godha, Masya, too much eating fish products. Aja, Avika, mouse, especially the red meat is very bad for the Pitta. Dadhi, too much eating curd or the yogurt. Takra, too much eating spicy masala tak. Kurchika, Mastu, Savirak, Suravikar, alcohol beverages. Amlafala, sour fruits. Katvar Prabhuti Bihi, Pittam Prakopam Apadyate. In addition to these, there are also Tat Ushnaihi, Ushnakali. The person is having Pitta dominant Prakriti, like Pitta Ekantik Pitta Prakriti or Pitta Vata Prakriti or Pitta Kapha Prakriti. If he indulge in the wrong food and wrong lifestyle in Ushna Kale, especially Grishma Rutu is bad for Pitta people. They should protect themselves working near the furnaces, working near the fire, working in the hot climate. That is bad for Pitta. Ghanantej Visheshtaha. Madhyane, in the midnight, at 12 o'clock, they should take the food. If they don't take the food at the proper time, they don't do the lunch, that will be problematic for the Pitta. Ardharatre, if they take the food in the midnight, that is also bad for the Pitta. Jiryati Annecha Kupyanti. Next, Kapha Prakopa. Kapha is what you can say the properties of the Kaphas. Snigdaha, Shito, Gururmandaha, Shlakshna, Sandra, Mrudusthiraha. So Snigdha means excessive oily is a property. Excessive sheath will be problematic for the Kapha dosha. Then excessive stability, sthira, sedentary lifestyle, not doing any exercise, not doing absolute any activity, that is bad for the Kapha dosha. Naturally, congestion problem will be there. Santarpana and overnutrition problem will be there. So these people should avoid the high calorie, high fatty food. They should check regularly their cholesterol levels because dyslipidemia, cholesterol more than 200 milligrams is possible in the Kapha Prakop, Diva Swapna. Sleeping in the daytime is not good for Kapha. That will increase the Kapha. Alasya, laziness will increase. Inactivity. Avyayama, not doing any exercises, sedentary lifestyle. Alasya, Madhur Amla Lavana. In the food, always eating sweet, sour, and salty. Too much salt. That is also bad for Kapha. Then there will be edema. All over edema will, cardiac edema, renal edema, hepatic edema will be increased. Sheath, excessive freeze attempts, air conditioning, always fan on the top. that is bad for the Pitta. Working in the cold climate, working near the water, working in the water, that is everything should be avoided. Always getting wet in the rain, that is also bad for the Kapha. Always cold and cough will start. Okay. Snigdha, excessive anchas, excessive fatty. Guru, heavy to digest. Pichira, sticky. Abhishandi, like curd, is also bad for the Kapha dosha. Viruddhan, incompatible food like milk and fruits, that is milkshake, is also bad for the Kapha dosha. Also, this is bad for all the doshas, Viruddhan. But Abhishandi, Hayanaka, Yavaka, Naisheda Utkata, Masha, Mahamasha. Then Godhuma, excessive eating the wheat products, that is all carbohydrate. Too much carbohydrate is Godhuma. Tila Pishta Vikruti. Then Dadhi, Pishta is also the carbohydrate. Dadhi, Dugdha Krishara, excessive milk products, always cheese, that is bad for the Kapha dosha. Payasa, Ikshuvikar, sugarcane products, sugar products. Sugar, whites are bad for the Kapha dosha. Like, for example, sugar, and then what you call is a in the white, what you say in the white is especially the sugar and the carbohydrates, that is bad for the Kapha dosha. Anup, Audak, Mouse, Vasa, Bisa, Mrunala, Kaseruka, Shringataka, Madhuravalli Fala, Samashana, Adhyashana. Adhyashana is excessive eating. That means you are full with your stomach in the lunch and dinner, and then you are eating the ice creams, sweet dish. That is not good for the Kapha, especially problem. Prabhuti bihi, Deshma, Prakopam apadyate. In addition to that, environmental factors, Shitehi, Shitakalecha, Vasantecha. Spring is the worst. In Vata dosha is a Prakupita in Varsha Rutu, that is rainy season. Pitta dosha is a Prakupita in the October heat. And the Kapha dosha is always Prakupita in the spring season, that is Vasanta Rutu. Okay. Shat Kriya Kal. This is nothing but the pathogenesis, Samprapti, how the disease process is taking place. First is the causes of the disease. Kal Artha Karmanam Yogo. Hina Mithya Atimatrakaha. Samyak Yogacha Vidneyo. Roga Arogyasya Karanam. So one side they are giving you how you can remain healthy, and another side they are telling you Roga Karana. When the Kal is your age, Kal is a daily hour, 24 hours, Kal is a 365 days, Kal is a season. There are different meanings for the Kal. But as I have told you, in Vasanta Rutu, Kapha Prakop will be there. In Sharad Rutu, October heat, Pitta Prakop will be there. In Varsha Rutu, rainy season, Vata Prakop will be there. So Vasanta Rutu, Vasantik Vaman Shibira. Always Vaman is a therapeutic purification for the Kapha dosha. In Varsha Rutu, you take the medicated enema, that is Basti for Vata dosha. In October heat, go for the Virechana and Rakta Moksha Chikitsa for the Pitta dosha and Rakta Dhatu. Okay, this is Kal, all about Kal. Artha, what is Artha? Artha is our sensory objects. When I see with my eyes, Shabda, Sparsha, Rupa, Rasagandha. Shabda is nothing but the sound, Sparsha is a touch, Sparsha, Rupa, eyes, Rupa, to see, Rasa with the tongue, and Gandha with the smell. So these 5 objects should be under control, optimal use. If your screen time is excess, always doing the mobile and rummy game and these all the another games, you are always with the series, daily soaps, going late at night and seeing the movies in the Hotstar, so Netflix. So excessive screen time with your laptop, with your mobiles, with your desktop, with your TV. So that is excessive use of senses. That is atimatra. Atimatra. Then mithya, always looking for some horrors and ugly things. That is mithya. Not using your senses properly. You are not going to expose your skin to the sun without any exposure to the sun. That is hina matra of the touch sensation. Are you getting my shabda sparsha? So sunlight should be on your skin. Then the vitamin D will be there. Then the calcium will be there. Otherwise, you will suffer from osteoporosis. Am I right? So this is the examples of how the less contact, excess contact, improper contact, all these contacts are faulty. But what is expected? The samyak yoga. Samyak means at a proper dimension, proper time, proper limit, optimal limit. This is called the word suvarna madhya, optimal limit. Golden mean should be there whenever you use any of your objects. Not eating anything, doing a lot of fasting, this is also bad. Eating excess with your tongue. That means I like sweet, so I will eat maximum sweet. That is ati yoga. Not eating any sweet. That is ayoga. Then eating always some odd type of the taste. That is mithya yoga. So you should nityam sarvarasabhyasa. Every day you should take madhura amla lavana katutikta kashaya, all the taste type of the food. That is samyak yoga. I hope you are understanding this artha. Karma. Karma activity are of three types: physical activity, psychological activity, and verbal activity. Kayik, physical, vachik, and manasik. So if you do this activity in a proper manner, in balanced manner, homeostasis, golden mean, optimal manner, then it is good. Too much exercise is also bad. Not doing any exercise is also bad. And unnecessary bending your hands and legs in the yogasana and troubling your body, that is also bad. Get proper training, use the props, and then you can do the yoga. It's not unnecessary training to your body, the yoga. Remember all these concepts. So this is not only the shloka recitation, but Professor Deshpande is talking about Ayurveda in every shloka. So these are these contacts of kala, artha, and karma with the human body. If it is hina, less, bad. Mithya, bad. Ati, bad. But samyak yoga is healthy, is good for you. Next, what are the Shat Kriya Kal? 6 stages of the disease. Sanchayam cha prakopam cha prasaram sthana samshriyam vyakti bhedam cha yo vetti doshanam sabhavet bhisha. Sanchay. The doshas are accumulated in their own places. Prakop, they excessively upgrade, uprise. Prakupita. And Prasar, they start flowing all over the moving, all the body, that is Prasar. And then the attack on the weak dhatu or the weak mala, tissues or the waste products. This attack is sthana samshraya. Then the disease is formed, that is Vyakti. Vyakti is not the person. Vyakti is exploitation of the disease. And Bhed, understanding the Vata predominance or Pitta predominance or Kapha predominance. That is called as a differentiation, differential diagnosis of the disease according to the dosha. So these are the 6 stages: Sanchay, Prakop, Prasar, Sthana Samshraya, Vyakti, Bhed. Chaya. First stage, Sammati Rupa Vriddhi Chaya. If you keep the milk on the fire, on the gas, and it start boiling, that is Chaya. Okay. Etani khalu dosha sthanani eshu sanchente dosha. Where the accumulation is take place? Vatasthana. You remember Vatasthana? Pakvashya kati sakti shotra asti sparshanendriyam sthanam vatasa tatrapi pakvadhana visheshta. Oh, don't get bothered. Don't get bothered. But I'm trying to tell you that Pakvashe, large intestine, is the main seat of the Vata dosha. Grahani is the main seat, main organ of the Pitta dosha. Chest is the main region for the Kapha dosha. So they first start to accumulate in their own places. That is called as a Sanchaya. Okay? Prak Sanchaya Truptaha, Tatra Sanchitanam Khru Doshanam. What symptoms will be there? When Vata Sanchaya is there, Stabda Purna Koshtava, fullness in the stomach, abdomen. Pitau Bhasata, acterus, yellow tinge to the urine, to the eyes, that is Pitta Chaya. Mandoshmata, Cha Anganam Gauravam. The fire will be less, Mandoshmata, and heaviness in the body. Alas, laziness, these are the Chaya avastha of Kapha dosha. Okay? Then the most important cardinal feature of Chaya dosha, Vidvesha, Karana Vidvesha. For example, if I eat too much in the marriage ceremony, in the afternoon, in the lunch, so naturally in the evening, I feel, oh, I should not eat now. I am full in my stomach in the afternoon. My lunch was too much, too heavy. So that is Sanchaya. And you get the nausea of taking the food. So Karana Vidvesh. Karana is, what is Karana? What is this? Is eating food is a Karana for heaviness of your stomach in the marriage ceremony, in the lunch. And then you get a Vidvesh, hatred to eat in the evening only. Okay. So this is the, if you're having a lot of cold and cough, and if you are asking, do you want ice cream? Oh, no, I don't want ice cream. Because there is already Sanchaya, accumulation of kapha in my nose and in my respiratory tract. Okay, do you understand? Next, Prakopa. Vilay anarupa vriddhi prakopaha. More, the composition is first, it is a little bit more compact in the Sanchaya, but in the Vilayan, the molecules are a little bit separated. Molecules are a little bit separated, and your milk which is kept on the fire in the gas, it is coming up at the top level of your vessel. That is Prakop. First is a little bit boiling, but then it is coming on the top. That is Prakopa. Kopaha to Unmarga Gamita, upward direction. Tesham Prakopat, Koshtatoda Sancharana, gurgling in the stomach with the Vata Prakop. Amlika Pipasa Paridaha, sourness in the mouth, nauseating feeling, too much Pipasa, thirst, polydipsia, Paridaha, burning, Pitta Prakop. Okay. Now Kapha Prakop, Annadvesha, anorexia, loss of appetite, Rudhyutpledaha, something heaviness in my chest, Tatra Dvitiya Kriya Kalaha, Vata Prakop Lakshanam, Strams Vyasa, Vyadaswapa Sada Ruk Toda Bhedanam. Toda is a pain. Important is a toda. Whenever Vata Prakop, pain will be there. Sanganga Bhanga Sankocha, Vart Harshana Tarshanam, Kampa, tremors will be there. Parushya, dryness. Saushirya, osteoporosis. Shosha, vesting of the muscles. Spandana, Veshtanam. Stambha, contraction of your muscles and bony joints. Stiffness will be there in Vata Prakop. Kashaya Rasata, in your mouth, there will be astringent taste. Varnaha, Shavo, Arunopuva, blackish coloration to your eyes, to your skin, to your face, to that particular organ. That is Vata Prakop. Pitta Prakop, Pitta Siddhaha, burning will be there. Rag, inflammation, redness will be there. Ushma Pakitaha, hotness will be there. Rubor, calor, dolor, bony joint arthritis, that is Pitta Prakop, inflammation. Sveda, excessive perspiration. Pleda, Struti, Kotha, gangrene. Sadana, Murchanam, Madha, giddiness. Katuk Amla Rasovarnam. In the mouth, you will get pungent taste, sour taste. Pandu, anemic condition, Aruna Varjita, all the colors except black. Kapha Prakop, what will happen? Shleshmanaha Snehaka Athinya. Hardness will be there. Kandu, lot of itching and pruritus. Shitatva, feeling cold with the Kapha Prakop. Gaurav, heaviness of the body. Pandha, Upalepa, Staimitya. Shof, edema will be there. Cardiac edema, renal edema, hepatic edema. Apakti, indigestion. Atinidrata, all the time drowsy. Varna Shvetu, whitish color will be there. Rasa, in the mouth. Swadu, Lavano, Chirakarita. Sweet taste and salty taste will be there. Now next, Prasar avastha. Evam Prakupitam Prasaratam Vayo. Vimarga Gamana. It will lose your normal peristaltic movements. It will anti-peristaltic, vomiting will be there. Excessive peristaltic. Vimarga Gamana. Atopa. Then for the Pitta Prasara, Osha, Chosha, Paridaha. All the body will get like a burning sensation. Dhumayana, like fumes are coming. Hot flushes in the menopause. This is nothing but the Pitta Prasaravastha. Pittasya. Then Arochika Avipaka Angasad. Loss of taste, indigestion, and Angasad. Loss of energy from all your body parts. That is Kapha Prasaravastha. Iti Shleshmano. Shleshma means Kapha. Lingan, symptoms. Bhavanti Tatra Tritiya Kriya Kalaha. Sthana Samshraya. Sthana Samshrayanaha Kriddhaha. Bhavi Vyadhi Prakodakam. Doshaha kurvanti yat lingam pururupanta duchyate. This is the definition of pururupa. Warning signals of the disease, prodromal symptoms that will be created in this fourth stage of pathogenesis, that is sthana samshraya. Vyakti avastha. Purovyakta lakshanata, jvara atisara prabhutinam cha tatra panchama kriya kala. The disease will be cleared. This is fever, pyrexia patient. This is diarrhea, loose motion patient. So you can diagnose the name of the disease. That is very clear in the Vyakti avastha. Jvaraha santapa jvaraha. When there is a santap, sharira manas santapaha jvaraha. When there is a irritation of the body and mind, that is jvara. Atisara, atisaranat atisara. Atisarana, loose motions, that is atisara. Pravahika, this is Vyadhi pratyatma lakshana. Cardinal signs of the disease. Pravahamanasya pravahika. Pravahana, straining while passing the stool. Amoebiasis, giardiasis. Kaman lati iti kamala. Kaman lati. Loss of desire. Not eating. No desire of the eating. No desire of the looking TV. No desire of study. All the desires are lost. That is in the jaundice, infective hepatitis. Grahini, muhur baddham muhur dravam. sometimes constipated, sometimes lose motions. Bhed. At urdhva etesham odinanam vranabhavam apannaha shishtaha. When the abscess is broken and the ulcer is formed, that is bhed. But in the disease process, in the Kayachikitsa, bhed means differentiation, whether this is Vata Jatisar, Pitta Jatisar, Ama Jatisar, Bhaya Jatisar, that differentiation is Bhedavastha. Jvara Atisar Prabhutinam cha Dirgha Kalanubandha. Another understanding of Veda. Dirgha Kalanubandha. Any disease, when it is become chronic, that is Bhedavastha. Tatra apratikriyamani asadhyatam upayanti. If you don't treat these metastasis, for example, when you talk about any cancer, malignancy, and your liver cancer spreads all over the body, that is nothing but the Bhedavastha. Okay? So I hope that you are enjoying these particular shlokas, but I will do only for the 36 shlokas. Up till now, there are 3. This is the third part of the shloka recitation and discussion. Please don't forget to share this video and subscribe my YouTube channel. And I wish all the best. We will see you in the next shloka, that is the fourth part of the shloka recitation and discussion. Thank you very much for your nice support.